All right, we're doing it. We're talking about healthcare. My favorite topic to discuss with all of my European friends. All right, a little bit of sarcasm there. No, I'm actually kind of curious because I think this is an important topic. I think that there are really, really amazing and good things that the European health system does, and also some things in the American health system that are good. There's a lot of innovation and stuff like that. So we're going to check out just a good collection of people's point of views and experiences between the healthcare systems, not even just in Europe and the US, but I think there's some Canadian ones in there as well. So should be a good time. Let's keep the comments polite. And yeah, there's gonna be some trash talking. That's all good though. All right, buckle up, hit the like button. Let's do this shit. Hold up, I gotta read all this. This is not satire. This is the state of healthcare in America for a life-saving ambulance ride for my daughter. The state of California, that's your problem, you're in California. The state of California is penalizing citizens who have insurance. As somebody who lived in California for the first 27 years of my life, I can tell you it's garbage. Horrible state. Beautiful state. Very nice, but it's, gosh, they just R-word you.
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
No fucking way.
It went up.
Yeah, the first bill we
Even he's surprised. He's like, it went up?
got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.81.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
This is
Oh,
wild.
I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay.
The American healthcare system. That's so messed up. First of all, that it's even $600. My daughter had to take an ambulance ride. How long ago was that? 3 years ago? Oh, we didn't actually have to pay for it because if somebody else calls the ambulance for you, you don't have to pay for the insurance. You don't have to pay for the ambulance ride. Police officer, a random person on the street sees you hurt, calls 911, gets an ambulance there, you don't have to pay for it. But if you're hurt and then you call someone and you need an ambulance ride because you made the call and you're requesting it, you have to pay for it. And then, like, this is bonkers. This is absolutely crazy. This kind of pisses me off a little bit.
For a premium? That's wild.
This is a new law that passed or started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so
That's
just
so
if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
It's this.
You should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that.
All right, so this must be like a California law, and they do stuff like this. It's pretty crazy. Oh my gosh, I feel for the guy. That is horrible. So it's better to be uninsured. And like my family, we have like minimal insurance. Like we try and just get, catastrophe insurance. And then we do kind of what he was trying to do. Like we do all of our doctor visits and everything. Like we just pay for them out of pocket because it's not expensive. It's not that expensive if you're just going outside of insurance. It's so dumb. If that doesn't tell you insurance is a scam, seriously, let's wake up. So they would have taken $600 uninsured. Insurance paid them $1,400 more than they would have gotten from you, but they still want $1,300 more from you. Got it. Let's be clear. This is a problem with insurance companies, not the people helping those without insurance. Yeah. All right, we're not starting good for the U.S. here. Let's go to the next
American healthcare. Let's talk about it because it aggravates me whenever people talk about free healthcare in Europe. Let's start off with Belgium. These are the tax brackets in Belgium. Let's say your salary is between 26 and 47,000 euros a year.
50%? Yeah, I get where she's going. She's saying, because I hear it all the time, in Europe, we have free healthcare. It's like, it's not free. You pay for it just through taxes. And I think most people understand that. But when you put free over it, the average American that hears that just thinks, oh, I get free insurance, not really realizing like, oh, it's not going to be like you're going to pay for it through your taxes. But anyway.
That means that up to 15,000 you're getting taxed at 25, up to 26,000 you're getting taxed at 40, and up to 46,000 you're getting taxed at 45%.
50%?
Now, despite those extremely high taxes, I don't know if many people know this, you're not fully covered in Belgium. As in, if you go to the hospital and undergo treatment, you'll only get reimbursed for 50 to 75% of the cost of your treatment. In other words, you're paying out of pocket for 25 to 50% of the cost. Now let's look at the US. The average salary for an American is 63,000. Let's say 64 for the ease of my calculations. The median salary for an American is 59. Let's go 60,000 for the ease of my calculations. The average cost of healthcare per month is $477 a month. You also have to take into consideration deductibles. I could only find the average deductible for 2020 and it was $4,300 a year. Oh, I forgot to say. So you multiply this by 12, and that's about 5,400 and some, but let's say 5,500 a year for the cost of your coverage. Now, let's say that the average deductible is like between 6,000 or 6,300. So in a year where you would spend these $6,300, that would mean that you spent about 11,700, but let's say 12,000 for that year. That would mean that about 18% of your gross salary would go to your healthcare in that given year. Again, that given year where you did spend your 6,300 in deductibles. Little interlude. Whenever people say that the US is the country that spends the most on healthcare, they don't mean that Americans spend the most on healthcare. Because I've been seeing this being spread around in my comment sections, but also in like random videos that I see on my For You page. America being one of the countries that spends the most on healthcare is because of medical innovations and medical advancements. In other words, this is synonymous with America spends a lot of money towards research. The wealthier the country, the higher the medical expenditure. Because the wealthier the country, the higher the contributions are. Most people wouldn't expect poor countries to put that much money in innovations where their people don't even have food. Do you know what I'm saying? So yes, the US is one of the countries, if not, I think the country with the highest expenditure to GDP ratio. So thank you for this, Americans. I appreciate it. Going back to this, a year where you would spend your 6,300 deductible, then the cost of your healthcare would be 19% of your salary. We compare this to Germany, with health insurance varying between 100 euros and 500 euros a month, or the public health insurance being around 14.6% of the average German's income. Again, so there's also additional contributions, but we're not getting into this. Something else that we need to consider is that 86% of US private sector employees worked for establishments that offered employees sponsored health insurance, with some employers actually just covering the insurance fully. I don't even want to go too deep into just the state of public health in mostly Southern European countries, obviously. For example, Italians having to not only pay high taxes and contribute to their nationalized healthcare, but also having to have their own private health insurance. Because if you've ever gone to an Italian hospital, you would know why people would also buy private healthcare in Italy. I would also like to talk about how the Affordable Care Act actually made premiums in the US skyrocket, but that's going to be for another video, I think.
Yeah. All right. She had a lot of data in there. Interesting. I understand where she's going with it. She's kind of comparing the numbers of what were like the real cost to health insurance between our countries. It's interesting. The US still would have been higher than Germany, but I kind of understand the hints that she's going, like the innovations and everything that's going on in the US, how much we put into our healthcare. In the European version of Breaking Bad, Walter just receives treatment. I definitely do think the US absolutely needs better healthcare from that perspective. But when it comes to the medical services themselves, the US is maybe the best. I've heard that before as well. I think the other side of this conversation is the actual cost of procedures is not regulated so much higher there, i.e. my medicine isn't covered despite ins and its $3K a month. Okay. Something to do. And I'll have all these videos linked down below if you guys want to go check them out yourself. Looks like we got a funny one here. I know this girl.
Someone, please, quick, get me a doctor. I think I'm having a heart attack. Well, you've come to the right place. We're just gonna need to see a credit card to put on file first. What? Can we figure that out later? I need help now. Can't you see this is an emergency? Yeah, sorry, sweetheart, but it doesn't work like that. We're gonna need a proof of payment before the doctor can see you. Look, I'm in a lot of pain.
That would be wild.
I came here as fast as I could and forgot my wallet. Well, sorry, we can't help you then. Please come back when you have money. Would you like a cough drop? I have an extra one. Oh, sure. Thanks so much. And here's your bill for $200. What are you talking about? This isn't like a doctor's office. Doesn't matter, because I'm actually a doctor and we love to give out surprise medical bills wherever we can. And the total for your visit today is $6,000. Would that be cash or credit? I don't know who has that kind of cash, so I'll do credit card, please. Great. And just one more question before I get your signature.
Leave a tip. All right. I get what she's saying. Yeah, none of that stuff is true, but interesting. I'm pretty sure this is a documentary. In New York, this is what it is like. Laugh my ass off. They ask for tips. As a chronically illness patient, this is pretty accurate. They don't ask you to pay before you do anything. If you want to ask, one crazy thing that the US does is if you go like down to the emergency room, you go in with a problem, immediately they just go treat you, do whatever they need to do. They don't ever explain like what the cost is before they do anything, even if it's non-life threatening. If you just have, I don't know, an issue going on with your stomach, they're like, all right, well, we're going to do an x-ray or a scan of some kind, ultrasound. They'll just go do that, and then you'll get the bill after, and you'll see that the ultrasound was $500, and then you have to go through your insurance. I think that they should explain the cost before they actually do anything, unless, of course, it's like life-threatening. But
system is working great. I got to tell you, for the insurance companies, they make tens of billions of dollars every single year. Oh, you're working for me. You're an average worker. I say, okay.
Good old Bernie, dude. I love Bernie. Don't love all of his policies and stuff like that, but I love how authentic he is and just true. And he's been the same for dozens of years. He's never really, he's not fake. I think that's why I liked Bernie so much, especially in, I think 2016. It was horrible what they did to him.
We're going to cover you, but you have a deductible. Do you know what a deductible is? Tell me. All right, people in Great Britain, listen up. Because if you're going to move through the American healthcare system, that disaster, you got to learn these terms. Now, when you get sick, you go to the doctor, right? Mm. How much does it cost you to go in?
Nothing.
Nothing? Oh, my God. All right. On average, let's just say you're a family of 2-3 people, you got a $10,000 deductible. You know what that means? That before your insurance kicks in, you got to pay the first $10,000 out of your own pocket. You got that?
Yep.
How many people do you know
what a deductible
who've gone bankrupt in the UK because of medical bills?
No one.
No one? Oh, my God. All right, UK, listen up.
He's got a point. People in the US go bankrupt from health bills all the time, medical bills. It does happen, and it's like, who wants to wait 7 years for it to fall off of your credit? I think they will garnish your wages and go after it if they have to. It's hard because it's like insurance is You know, I understand the point of view of in Europe having healthcare and to have everyone just pay taxes and pay into it automatically. So if they do get hurt, they don't have the burden of having the bills. But there is a way to actually save more money and pay for it yourself. It's just that not everyone's responsible and does it. So it makes sense that a universal healthcare system works. But then you got to make sure that everyone is actually healthy. We can't have universal healthcare in America because everyone eats like shit and garbage and food and gets sick. And like we have more diabetes than everyone because they're drinking milkshakes from In-N-Out. Like if we were able to course correct and have the food better, then universal healthcare would actually make sense.
Here's the new one, new phenomenon for you. You now have the opportunity, if you move to the private system, to go bankrupt because of medically related debt. This country, UK, has a right to be enormously proud of what you accomplished way back in 1948. Strengthen your system. Put money into the system. Do what you have to do to make sure you have the doctors, the nurses, the other ancillary care that you have. Don't go the American way.
See, and Bernie actually cares. He actually does care about it, you know? That's one thing I can appreciate from him. All right, let's go to the next one.
I genuinely want to know who lied to you all that healthcare system is better in Europe. My mom paid taxes for the public healthcare system in 2023, and by taxes I mean a gigantic amount of taxes. And guess what? So she needed to go to doctor for some advanced checkup, right? The waiting time for that specific appointment was 1 year and 2 months. For people that didn't hurt, I said 1 year and 2 months. That's 14 months.
That's crazy.
14 months for one appointment. So she had to go to the private healthcare, which cost a shit ton of money, because besides the fact that you pay for the private healthcare, you pay public healthcare by taxation too. In America, for example, in most of the cases, your employers pay for the healthcare, right? Now, after the healthcare plan kicks in, you still have to pay a small fee. But even with that fee, you probably still pay less than you will pay in Europe percentage-wise, and you don't have to wait like 1 or 2 fucking years for an appointment. Now, in America, if you have a surgery or some complications, you're going to be way better flying to Europe, get treatment for 1 month, staying there for 1 month, and coming back to America will be way cheaper. But if you're a regular person who eats well, exercise, take care of themselves, chances are you're not going to need to go to the doctor often. So you're not going to use the healthcare so often. In Europe, even if you use it or you're not using, you still have to pay for that. I don't want to say that one is better than the other one, but stop glorifying the Europe healthcare system. They both have ups and downs, so they're both good.
Yeah, I think that's the thing, dude. I think we're all missing something. There's got to be something better, like a better system that we can create. I don't know. Everyone is saying you have to wait in America. I could literally make an appointment for next week with every doctor. Yeah, you don't really have to. I mean, unless you're trying to go to a specific type of doctor, like we go to a holistic doctor's office, and the wait time to just get in there was a little bit longer. But once you're in, getting an appointment's not too hard. But if you go to just your standard doctor's office, you can get in really quick. It doesn't take that long. Yeah, companies don't pay for your healthcare. This girl's right. Yeah, not all companies do that. My husband and me to be. I was like, what? On my insurance is $5,000 a year. We have a $16,000 minimum deductible we have to hit before we even start paying anything. I don't think she understands how that works. No, the $16,000 is what you would have to pay before the insurance starts paying for anything. $5,000 a year is not that bad though. I mean, depending on how much you make, if you make $30,000 a year, $5,000 is probably a lot, is where universal healthcare would make more sense. All right, I don't want to get held up. We got a couple more that I wanted to get on. Let's check this one out.
For a baby?
$2.5 grand.
So if you're poor, you're dead.
Ambulance call out. How much do you think that costs?
Zero payment.
Zero payment?
Yeah, zero payment.
No. It costs $2,500.
For real?
Yeah.
Oh, okay.
I already know that these people probably took like the highest possible price they could find for some of these services. Even when you pay for an ambulance ride, it's not going to be $2,500. It's a little bit closer to what the guy in the first video said, $600, maybe $1,000, $2,500. I guess that's eventually what they wanted to charge him, but your insurance should cover it. Most people's does.
Cool.
you look cost
pretty wild though.
Jesus. 50 grand, something ridiculous now.
100?
50 grand.
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand?
It can cost a lot to have
For
a
a
baby.
baby?
Well, I guess. How much is your child worth?
Yeah. Well, is that like the same everywhere?
The average is about $10,000, yeah.
That's mad. Oh, no thanks.
Give birth by...
We didn't, I think for all three of our kids, we never paid that much. Maybe paid like $1,000 when we had our children. My brother and my sister-in-law, they just had their kids at home, but they actually probably paid more than us because you got to have the home care and all that.
C-section.
Yeah.
And you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah, you have to pay to do that.
Yes.
To hold my own child that I've been carrying inside of my womb, like $100.
$40.
That's pretty wild.
$40.
For skin-on-skin contact. 2 EpiPens. How much do you reckon they are?
$80.
600.
$40.
I'm afraid not.
More?
More?
$100.
More.
150.
More.
250.
More.
Shh. Shut the fridge.
More.
£300.
Double it.
$600.
That's nuts. I think I don't know. We don't take any drugs in our house. So I think I heard that drug prices have been starting to come down, though, here. I know that you guys in Europe get them for practically free, if not like very minimal amounts. The US is one massive subscription service. Why is no one having kids and then they charge $10K to give birth? Hey, that's true. Happy to be child-free. The U.S. healthcare system is outrageously expensive and nothing is fixing it. Happy to be child-free. I don't know. I feel differently about that. I think having kids is the best thing you can do. That's insane. $40 to hold your own baby? America is a simulation, I fear. Yeah, like I said, that's not something, if you're in California or New York and you're in like some really nice hospital, they might charge for that. But most places, they don't charge. We didn't get charged for that, all three. So, all right, let's check this one out.
Healthcare is not about healthcare, everybody. 90% of all our health problems are preventative. It's the food that we eat, the lack of our activity, the lack of vitamin D, the lack of supplementation, and the fact that our doctors are trying to push a pill for every ill. It's not a money problem. It is a systemic cultural health problem.
So, like, countries in Europe that have universal healthcare, that have amazing health, you don't think their ideologies in healthcare can work with us at all?
Well, part of they actually are also seeing somewhat an obesity problem. It's not as bad as here, but number one, they pay higher taxes. Number two, I would not necessarily look at the universal healthcare system of Britain, for example, as a great example. You could wait months sometimes for necessary care, sometimes almost a year. Number three, they also have much better farming in Europe. That is one thing I will give them. They have regenerative farming, and I might get a lot of enemies here in central Illinois. A lot of you hate it, right? A lot of farmers are going to kill me for saying this. The way we farm in this country is so destructive to the nutrient value of the food that we eat. And I don't know if you guys know this, but if you ever visit Europe, the food is it agrees with your system far better from a digestive molecular view.
Yeah, he's Charlie's 100% right. Yeah, the food system here, that's got to get solved before anything, before we try fixing like the actual healthcare system. Got to fix the food. He is right on prevention, but wrong for saying it's not a money problem. Healthy habits are unaffordable. Gym memberships, healthy food options, yearly exam, it's all too expensive. Gym memberships, even at the nicest gym, you're going to spend like $150 a month. It's not crazy expensive. How much is your health worth, you know? Healthy food options, again, you might pay 10% more than you would normally pay. I think it's worth it, but I'm jealous that you guys just have that naturally in your countries, though, like better health and more activity and walking and all that. It's something we need to be able to do better. Even with the wait time and the higher taxes, Britain's healthcare system still outranks America's. Kirk's just a greedy man who wants no regulation to help curb the sin of greed. I'm pretty sure he was just talking positively. All right. Well, also, it doesn't help that our government pumps chemicals into our food. Yeah. That doesn't help at all. Look at that, you guys. We got a Bernie video and a Charlie Kirk video in one video from an American. You can see that we're not all ideological and some of us are balanced.
Stop the press. I think I have something positive to say about the American healthcare system. You guys know that I love it here. I love America. I love American people, but I'm not naive. There are things I don't like, and there are things that I know are not good here in the US of A. Healthcare is definitely on that list. The whole cost of healthcare, the fear of the cost of healthcare and all of that, 100% I'm with you. But my little channel here, my little communication community audience channel here, is trying to be positive about America because there's so much negativity, and I just want to show you all the positive things and remind you of the things that I am so grateful to experience. So we don't do moaning. If you don't know, which I'm sure you all do, but the UK healthcare is free. We have something called the NHS, the National Health Service, and it doesn't
Again, people calling it free. That's so wild to me.
matter whether you are poor, rich, old, young, whether you're going to the doctors, whether you're going for emergency surgery, like whatever it is, it's free. sounds amazing. But my family and I have been let down by the NHS more times than I can count, at the expense of our health. And I have a lot of negative things to say about it. But again, this is not a place for moaning, so I'm not going to go into it. But basically the gist of it, because it's free, it's overused, it's understaffed, the staff are underpaid, and it's a big old vicious cycle of you can't get what you need when you need it. So last year, before we moved, I went to my doctor's for free in the UK. I had a mole that I was concerned was getting bigger. Doctors only get like a stupid amount of time with patients in the UK. It's like less than 5 minutes that they get per patient, so they can't really do their job properly. She got out her little ruler and measured this mole, and it was like 0.5 millimeter smaller than the measurement that they needed it to be to refer to the specialist for it to be removed. So I got sent home for it to wait to grow another 0.5 millimeter, and then I would be referred to get it taken off. And by the way, if I'd have been referred for it to be taken off, I would be waiting for a very long time. And obviously this mole could well be cancerous. That is not uncommon. There could well be symptoms that are typically cancerous or something that is going to be very negative for your health, and you're still put on a very long wait list. My option at that point was to go private, which you can do in the UK, and I looked at going private to have a consultation to check all of my moles, and it was like several £100s. So when we get here, we get settled in, I think, okay, I should probably go and get this checked out, and I'm like, oh, this is going to cost me a small fortune. I do not understand how insurance works here. I need to get to learn it better, but in summary, to zoom to the end, it costs me $90 to get probably about 20 minutes with a dermatologist that I booked a next day appointment to have all of my moles checked through my scalp, under my fingernails, everywhere. The dermatologist was concerned about the mole that I had originally gone to the doctors about, and he was concerned about 3 others that I hadn't even noticed. Watching this from the UK, you will not believe what happened, because I was in disbelief. He took them off there and then. I had already been with this guy for like 20 minutes just chatting about skincare, and then he was like, we're probably going to need to take those off. I'm a little bit concerned about one of them was the colour, one of them was the size, whatever. Let's just take them off right now. And I'm like, what, I don't have to come back in a year from now? Then I'm like, well, wait, how much is this going to cost me? This is where you get me. This is where America gets me. I've been told, I've seen the horror stories. I know this is going to be thousands of dollars. $230 something to get them all removed. That is cheaper than the consultation would have been in the UK that I would have had to wait months for. He sends them off, and I'm, again, from my years of NHS torment, expecting to just never hear anything again, because they will never call you even if you're dying. And exactly 1 week later, when he said it would be, they called to let me know that 2 of the moles were fine and 2 of them were like pre-cancerous, but what they'd done was already fine. No need to worry. Just go back in a year for another full checkup, and like everything's fine. Nothing to worry about. And I was right about that mole that the NHS didn't want to take off and wanted to leave. It was pre-cancerous, which means if I had left it longer, for all they knew, by the time that it was the right size for them to remove, it would have been a bigger job, a bigger problem, more detrimental, and more cost to the NHS for them to take off. So, my jaw hit the floor. Timeliness of the service, the cost of the service, the customer service is unlike anything I've ever experienced on the NHS in the UK. And I go back to what I said at the start of this. I know I'm going to have some very, very horrible experiences with the American healthcare system in the case of emergency, or just like sickening amounts of cost for painkillers if we have a child here, or I know, but I just wanted to give a little bit of a positive story because I was really thrilled with my experience.
I wasn't expecting that at all. I'm a little caught off guard. First comment, someone says, no one understands the healthcare system. Yeah, 100%. Nobody understands it. If it makes you feel better, us Americans don't understand our insurance either. Yeah. Oh, gosh. It's taxpayer funded. They need to stop saying it's free. I was thinking the same thing. That's pretty crazy. We're going pretty long here. I don't want to hold you guys up. Let's look at one more. Let's look at Joshy here.
Healthcare in Italy versus healthcare in America. Italian healthcare. It's included in the taxes. Yeah, guys, we pay a lot of taxes. The average income in Italy is $28,000.
Okay, this is like the 3rd time we're on the topic of Italy. I really want to cover like the Swedish healthcare system or the Finnish healthcare system? Because I think they're just like the most healthy people. So that's probably why it's so good, right?
$1,000 a year. Net, you're probably keeping 18, maybe 20. That is a lot of taxes, guys. That is the equivalent of the $200,000 tax bracket in America. Actually, I think even higher. Correct me if I'm wrong, please. Anyway, you break an arm, you get it fixed.
No,
quite well. You need to replace a kidney, you get put on a waiting list. A long one. Probably by the time it's ready, you're gone. So what do? You go to the private healthcare, if you can afford it. So for general healthcare issues, it's a good thing. Insulin, that kind of stuff, yes, Italian healthcare is good, it protects you. However, for the really hardcore shit, private. Also, because the more complex stuff is expensive to the state, you're less likely to be approved for more complex operations and more likely to be approved for a patch. Let's say you have some back issue, like the beginning of a hernia. Instead of sending you straight to surgery to take care of the hernia, you're more likely to do some basic physical therapy. We prescribe some, let's say, exercises because it costs to the state, it's a little complicated, and it's easier to address it. Even though the quick fix would be the surgery. Now let's talk about America. American healthcare is for profit. So because it is for profit, it is very efficient from an execution standpoint, but too economical to be seen as correct. Let me make you an example. I go to the dentist. My dentist has been telling me here in America for the past 4 years that I need to remove my wisdom teeth. Because I have a dentist also in Italy, I show him the pics that I got about my teeth, and the guy in Italy tells me to chill out. I get a second opinion, and I tell the guy in America to fuck off. My teeth are good, but because his wisdom teeth can always create a problem in the future, and it is profitable to have a referral to take them out, they always tell you to take them out. On the other hand, if you need surgery and you have insurance, it's gonna happen very quick. One big problem that America has is lack of information to the buyers before they get into the hospital. I feel like if you could shop for the hospital and the surgeries like you're shopping on Amazon with reviews and general costs that you're expected to pay, healthcare will be cheaper. The problem here, you walk in a place, you get the operations done, and then you realize how much you have to pay out of pocket.
Yep,
it's like going to the dealership, buying the car, signing the contract, and then learning how much you have to pay. Whoever will be able to create an Amazon shopping store online for healthcare will make a lot of money in America and will reduce the insurance costs for everybody. Because with price transparency, you create competition among companies. And with competition, you're reducing prices.
Capitalism. Price transparency, that's what Trump wanted to accomplish. This is from 2023, so it's a little old. I haven't really been keeping up on what Trump is doing with the healthcare system. I have no idea. Yeah, we have bigger problems right now. America could fix the problem by having a Medicare buy-in option for everybody. Pay a monthly premium and have Medicare. Now insurance has to compete. Good idea. But then most people get Medicare for free. In the U.S., I have private insurance through my employer. I pay 23% taxes and 25% of my salary for insurance. I can't get an MRI. That sucks. I don't know. There's just so much damn information, and like it's just, I don't know. It's insane. Well, I thought that was good. I had even more videos. Well, if you guys enjoyed this one, we can do another one hearing from more both sides. I think there's about 6 videos that we didn't cover, but I've been going for 35 minutes and I don't even know if anyone's watching anymore. So just drop in the comments if we want to go through this again and chat it out. Us people figuring out how we're getting fucked by the government. All right. Appreciate you guys watching. I'll see you in the next one. Peace.